On the final day of this month, a grim milestone to report. January 2021 has been the deadliest month in Ontario since the pandemic started. More than 1,600 people have died, and half of them were long-term care home residents. Advocates calling for justice say money that could be spent on fixing deadly problems inside these homes is now being wasted on security guards.
Not one individual that I can think of would ever suggest contributing to a police state in long-term care.
After months of demanding urgent action to address the crisis inside Ontario's long-term care homes, advocates say the Ford government has gone ahead and implemented a measure nobody asked for, investing $42 million to hire security guards, money that advocates say could be better spent on hands-on care for residents.
It will not keep COVID out. It will not make the residents safer. What we need to spend that money on is more nurses and skilled PSWs.
They say hiring more PSWs and nurses and setting a minimum pay standard for frontline staff would make all the difference. But the Ministry of Long-Term Care says security guards could conduct screening at the homes in order to ensure frontline staff can remain focused on caring for residents. Advocates point out it was never frontline staff conducting screenings, and there was already a smooth process underway for vetting visitors.
Every long-term care home has administrative staffers that already do the screening. There would never be a nurse or a PSW providing this screening because their help is so badly needed on the actual floors with the residents.
And tonight, there is a renewed push to get another tool inside long-term care homes faster. One that could save many lives, rapid tests.
They function well in an area or location where you want to know if the spread has happened quickly and what's happening.
We've received updated numbers from the Ministry of Health. Ontario has received almost 4 million rapid tests and distributed just over 1 million. 160 employers are currently using rapid tests as part of workplace pilots, and 300,000 tests a week will go to help key sectors, including schools and long-term care homes. But there are still limitations to rapid tests, and they aren't as accurate as PCR tests.
One of the challenges with these rapid tests is that you need a lot of virus in you for it to show up.
It could also take hours to get results. A common misconception is that rapid tests work like pregnancy tests, where results are available within minutes, but the samples still need to travel to a lab for processing.
It's the processing of that test and then getting the results that's taking longer than we would expect the definition of a rapid test to work. So until they figure out what's a fast way to get results in a long-term care home as quickly as possible, that's still the limiting factor.
Still, she says rapid tests are absolutely better than nothing. Now, advocates are also calling for military intervention inside hard-hit long-term care homes where staffing remains a significant problem. But the province says their assistance isn't needed at this time. Instead, they say we need to continue to push the federal government to deliver vaccines in order to continue vaccinating the province's most vulnerable residents.